Hello, I'm Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health. All right. Good evening, and welcome to another exciting episode of Telehealth Tuesday. I'm your host, Dr. Michael Bookhardt. Today we have a very, very special episode just for you. I got my guest here, Mr. Derek Rainey. Can you hear me, good brother?
Yes, I can hear you. Can you hear me, brother?
Absolutely. We had just a little echo. I'm going to try to trim that down a little. Okay, try something there. Try something.
All right. Let's see if you can hear me clearly now. Is that better?
Yeah, that's pretty good, man. I wanted to go ahead right to you there so we could get started. I know we were running behind just a little bit here. There's
Yes.
always, sometimes the devil's busy, man, but he is not going to be the victim.
I know when you're right about that, brother.
Yes, indeed. All right. How are you feeling today?
Man, I'm feeling pretty good, man. Bro, you know how it is out here, man, and we work hard. We're going all the time, and it starts to catch up with you. So body gets a little fatigued. So I've been kind of fatigued and tired all day, but nonetheless, I'm doing good.
And that's awesome. Well, we're glad to have you. I wanted to jump right into it, man. Let's tell the audience all about yourself. Who is Derek Rainey? What do you do here in Mississippi? And tell us all about Speak. Is it Speak Influence or Influential?
Speak Fluence.
Speak Fluence.
Yeah. Well, man, of course, I'm Derek Rainey. I grew up, Mike, was actually born up north in Milwaukee, and we moved south in '79, right after my parents separated. Grew up in Canton, so Canton is my hometown. That's my hometown, exit 119, man. Love it. Um, Man, I've been in the auto industry now for 31, going on 32 years, and so 10 years I worked for Toyota Lexus as a tech. I actually went to college, man, for Toyota. That's who paid for my college. Yeah, that's who paid for my school. Went to college with them, worked for Toyota Lexus as a tech for 10 years. Excuse me. And then went into education. So I've been in education now for 22 years, been teaching automotive for 22 years, man. So it's been an exciting journey. I've also pastored, man. I've been a pastor for 20 years.
Really?
Yeah. So now we more of a virtual thing now because after COVID, man, it did a number on us, and a couple of other things that happened that did a number on our facility, on our campus. So we've had to bag up and be virtual since last July. But I Speak Fluence is something that I just launched this past January. I'm excited about it. It's a platform to help people be able to present and to speak. A lot of times people, you see it so much now on social media, where there are a lot of coaches out there that want to help people to book the speaking gig, get the gig, and all of that. And I'm just like, and that's wonderful because you need that too.
That's right.
But then once you get the gig, you got to be able to have something to say, right?
That's right. That's right.
And so that's where Speak Fluence comes in. I specialize in dealing with the art of speaking. How do you present? And so I kind of, it's very intense, man, but it's really good. I've been doing that the last 19 years with college students, teaching them how to speak and, competing, state, national competitions. I've coached so many to first place winners in the state. I've coached several teams to national placement, man. So now I'm just taking all those things that I've learned, in those 19 years, and now, want to help just, whoever speaks, and so it's pretty good, man. Thanks for asking.
Absolutely, man. Well, honored to have you. See, Remy is here. What's going on, good brother? He's Remy was supposed to join us as a, we were going to have the panel. Derek, you and I,
Yeah,
we were together with all those good brothers yesterday, and it was just this
yeah,
real organic thing that we had where gentlemen, two of the gentlemen in the crew up there, they were talking about
right.
they have some heart issues and irregular heartbeat, are known as atrial fibrillation, and another gentleman was talking about history of prostate cancer and other things, and um, one of the big things, that we all talked about, it was what, about six or seven of us, and it was that so many of us African American men share these things where you might have hypertension, diabetes, atrial fibrillation, enlarged prostate, no matter what it is, but so many men are scared to talk about their health, to go see the doctor. Why do you think that is?
Um, Lack of trust, man. I think that's the biggest thing. Men, we struggle with trust, um, in a number of ways, and especially when it comes to our health.
Mm-hmm.
That's just something. I mean, even if you look at, man, just how we were brought up, right? Um, we were brought up to be tough. You know, we would kind of, we couldn't cry. If something hurt us, right? We were told to suck it up and keep going. Um, and so I think a lot of that upbringing, man, we just in so many things, even when we feel uncomfortable, even when we're hurting
Mm-hmm.
or something doesn't feel right, you know, I guess it kind of goes back to those formative years of sucking it up, man, and we just suck it up and we keep going until the body just says, okay, all right,
Yeah,
I'm gonna show you. You know what I mean?
that's right.
But I think the biggest thing is a lack of trust, man. We just don't trust.
So, and I see Remy can jump on. Yeah, I think since we've already got it set up, then Remy, if you can help us by just maybe giving us some of your questions or feedback right here, that would be great. Oh, excuse me one second here. I'm gonna put this. Let me try 1 second here. Get this going back on. Get it going back on Instagram. Um, let's see. Public audience. Instagram's a little tricky with trying to stream to them. Um,
Yeah, yeah.
kind of dicey there.
Oh, you got to set up though. You got to set up though, Mike.
Yeah, we got it set up, and I'll come back to that. Let's
So
see.
where's Remy? Is he going to be on camera or how is he on?
Yeah, he was going to be on camera, but I think since we already started and it's streaming on multiple platforms, it's hard to. I may be able to add. I may be able to add. We got Kanoa in there. What's going on, brother? I know he's always going to
Kanoi.
ask. Yeah, he was the first comment and said, "Hey, does homeboy take insurance?" I'm like, man, come on.
Tell Kanoi, what's up, man?
Yeah,
Yeah, that's hometown right there. That's hometown.
yeah, man, absolutely.
Yeah,
Yeah, it looks like I was trying to get this thing to go, and they saying add me. Yeah, that's kind of a
yeah.
little bit hard to do. Remember, are you in some place where it might be a little loud where he is? Yeah, it's gonna be kind of hard to do that one, brother. But see
All right.
if you can ask us if you can join in or ask us some things on there. Let's see.
Yeah, we can roll with it. We can, let him however he chimes in. We can roll with that. We'll adjust.
Yeah, absolutely. I'm trying to see how to. Okay, yeah, I guess the Instagram part is just not gonna cooperate today. Uh, we'll take that off. Okay, we'll take that off. But yeah, please, everyone. He's saying I can make it work. Um, hold on 1 second. I'm gonna try something here, but let's see. I'm gonna try something. But I don't want to mess it up. I don't want to
Yeah, I'm
mess
in my truck, man. So you'll hear all kind of stuff.
it up. Maybe let's see here. Uh, this speaker. Yeah, it's gonna. Let's see. I'm gonna try one other thing. Style effect. Yeah, it's gonna be kind of hard there, Remy. Yeah, it's gonna be kind of hard there, just to get you in there. Yeah. All right. Well, we'll have to just roll with it there. Let's see here. Remove from scene. Okay. But yeah, if y'all can just everybody, like I said, we'll pause for the cause. I want everybody to know this is Telehealth Tuesday, episode 35. We're here with Mr. Derek Rainey of Speak Fluence, and we are here to talk about. We're focusing on men's health and prostate aware, even though it's not necessarily prostate awareness month. But since we were sitting in an establishment yesterday and we had this really amazing talk about why don't the men go to the doctor? And I said something real funny, like with men, especially African American men, there's only two reasons they go to the doctor. Number one, the woman in their life is forcing them to go, which is their mother, wife, daughter, whoever. And the second is that there's some problem with their penis. And so everybody always gets a real laugh out of that. But that's real talk. That's serious business. So
Yeah, that's true.
yeah. So anyway, you talked about trust with in the medical community. A lot of men don't trust doctors, and of course, this is not always about just race, but we do know that there is objective data that a lot of times in this country and in certain states like the South, like Mississippi, that African Americans don't either do as well or get the same standard of care as other people, and it's very unfortunate, but those are just the facts, especially in African American women, having a lot of issues around childbirth and having so many complications. And there's other factors in that as well. But anyway, let's
Yeah.
talk about this. So let's talk about prostate health. Do you feel like there's a reason why a lot of people are embarrassed to talk about that specifically? Like, do you feel like there's a certain fear of death or fear of shame or something like that?
I, you know, I'm not fearful to talk about it. It's not something that really bothers me because I've gotten to a point and an age where I take my health seriously.
Absolutely.
But when you think of any kind of cancer, especially prostate, I think it is for us as men. Embarrassment
Mhm.
can be a factor. Fear, what's actually going to happen, and then there's the mental, man. I mean, you balance so many things mentally,
Right.
that and I've seen a lot of people, people deal with sickness differently. Some people are very open and out
Mhm.
front with it, and they want all the support that they can get.
Right.
Um, and they're not ashamed to tell anyone. But then you have other people, man, who are very private. They don't want to, they're very secluded. They're very private. They don't want nobody to know.
Hmm.
Outside of maybe their spouse or something. They just go through it privately and they deal with it like that. But I think fear, man, fear of what's going to happen. What do I got to go through? How much I got to go through? Am I going to overcome this? Um, Embarrassment, particularly when you start dealing with chemo and what it does to the body. So
Hmm.
I think some of those things, Mike.
You said, what was that last thing?
I know. I just said I think it's a number of those things.
Oh, number, yeah, yeah. I think no,
Yeah.
you're absolutely right. And but we've just got to do better about that, man, because we've got people that are dependent on us, whether it's your mom, your wife, your sister, your daughter,
Right.
uncle, auntie, whoever. We've got people that depend on us, and so we've got to break out of that mold. Same way that people don't want to go to the dentist, including me. We have got this fear, like they're going to drill or do something painful to me. But when
Mm.
it comes to prostate awareness, people don't know that we can just do a simple blood test. We don't have to do the uncomfortable rectal exam, going through the rectum and all that kind of stuff to physically check the prostate. And so we can do that that way. But also another topic, I wanted to touch on the mental health. That's another thing that we don't talk about enough in the Black community, about mental health. We're always saying, and especially in the Bible Belt, well, I can just pray this away and this and
Mike,
that.
are you okay? Mike, I had lost you for a minute, but I'm back with you. Go ahead.
Okay, yeah, I was just saying that when it comes to mental health, a lot of times that we'll say we can pray it away, unless that we don't need to talk to no shrink. I'm not crazy, but I wonder, that's another question. Do you feel like we do enough in that arena when it comes to mental health?
Okay, re-ask that question because I lost you for a
Okay.
minute, and I wanted, yeah.
Oh, I was saying, for some reason especially in the Bible Belt, we'll say, well, I don't need to go to see a counselor or a therapist or a psychologist, psychiatrist, because, God is going to bring me through it, or I don't need some outside person to make me look crazy. And so I'm just wondering, do you feel like there's something we could be doing differently when it comes to mental health?
Oh man, that's a good question. Now we are in the Bible Belt, and anytime you're dealing with any kind of physical ailment, man, we know that your faith is going to be it's going to be an important part of it,
Hmm.
because you're going to have the right attitude, the right mental attitude as you're going through whatever you're dealing with anyway. So you know the faith aspect is very important, but I also, man, when I try to talk to people, man, I tell them, hey, we got to be realistic too. You know what I mean?
That's right.
Yes, God can. I mean, He's a healer. He can flip. I mean, He can flip that thing overnight if that's what He chose to do.
That's right.
But there are some cases, man, that we deal with, and therapy. That's something that we need to start taking advantage of, and being able to talk to somebody and being able to kind of vent and let people know exactly how we feel. And even for us, as like, even for those of us that's married, man, as men, it's even difficult sometimes to even just come clean with our spouses as men, and just let our spouse know how we really feel. You know what I mean? And because
Yeah,
we feel like we got to be the man, whatever that means. you know.
Hey, that's that toxic masculinity.
Right. What's up, Remy? How you
Yeah.
doing?
What's up, man? How you doing, boy?
I'm good, brother. Hey, but that's it, man. We just like we gotta be strong. We gotta be strong, man, when we need to talk to somebody, because we can't we can't carry it by ourselves, and it's good to have a support
mhm,
system to help us with our mental health issues, man.
absolutely. Well, Remy, I think it looks like you've been following along. I'm glad I was able to figure something out to add a speaker when it's going. So, man, I'm
Yeah.
glad to see you can join us.
Yeah, you did it, brother. I'm here now, man.
Yeah, I'm glad you got on, man.
Yeah, man. How you doing, D?
Hey, I'm doing good, brother. Can't complain. I'm glad Mike have got me on here, man, this evening. So hey, I'm just taking it. I'm enjoying it, really, and
Yeah,
this is a good
Dude,
conversation too.
hey, D, his platform is amazing, bro.
That's what's up, man. I like that. I like that.
It's amazing.
yeah, I appreciate that, fellas. Well, Remy, maybe you can touch on that and give us your thoughts when it comes to. We talked about the topics of prostate health, why men are afraid to go to the doctor, and I let the audience know that you don't have to for men have to do an uncomfortable exam going through the
Yeah,
person's rectum and all that
yeah.
stuff. So the other thing,
Listen,
yeah, and mental health. Like, what are your thoughts on why we as men
listen.
don't go to the doctor and don't respect mental health?
I I literally can literally come in this perspective firsthand, right? Because I needed both. Okay. And when I first got divorced from my marriage, toxic masculinity took over,
Hmm.
and I was not able to accept the fact that I needed help. I just couldn't accept it because I'm a man's man. Like I'm a whole dude. Like I'm an alpha male. So it's like, okay, nah. I'm good. But let me say this to anybody that's listening: go get you some help, man. Go get you a psychiatrist, man.
That
Go.
we can't really see you there, Remy.
Can you hear me? Can you see me now?
Can't see. Yeah, if you can lower the camera, I think it's.
What about now? D, can you see me?
I can see you.
Okay. Well, yeah. What I'm saying is to all the men, screw all the toxic masculinity. Go find you a doctor, a psychiatrist. It will make your life different
Hmm.
because we've been taught that needing psychological assistance is a weakness, right, guys? We've been taught that it's a weakness.
Yeah,
That's what we've been
yeah.
told, but it's not, man. Understanding and seeing your weaknesses is more important than seeing your strengths. Go get some help. Go find you a psychiatrist. Get you some help, and then maybe sometimes we can literally talk. Can you see me now, Mike? You got me.
Yeah, just more so it's on the top of your head. You had it at first. If you can maybe back up
All
the
right,
camera a little bit and point it
all
down.
right. What about now? We good?
No, it's even worse. We're looking at the trees. You got pointed down.
They're beautiful trees, though. They're beautiful trees.
Yeah, I don't know what. Yeah, you had it right at first. It was. Now you're just on
All right.
the tree. Tip it down.
Okay. What about now?
Yeah, and then maybe back it up from you.
That better? Okay. Now. Okay. So
Now,
what I'm saying is,
uh-huh.
I had to understand my weaknesses before I was able to include my strengths.
Hmm.
It, Getting some self help, man, going to the doctor is nothing. I just left the doctor. I just left Dr. Katzenmeyer like a couple of hours ago. He was
Hmm.
trying to keep me. Like he was like, nah, may need to keep you. And I'm okay with that. But men, the toxic masculinity is the problem. Am I right there? You agree with that?
I do, man. I agree with that. And two, something that you said when you said go get you a counselor or a psychiatrist,
Hmm.
even for people that's even for people that's believers. If you're a believer, you're Christian, or or whatever
Right.
your faith. But for me, I'm a believer, man. I love the Lord, right? But
That's
we
right.
have there's Christian counselors out there. You know what I mean? That
Right.
can hit that thing from a biblical angle. And so and I'm the world worst too, Remy. So when you start talking about that, what you call it, masculine, what you call it, toxic masculinity,
Toxic masculinity. Yeah.
I, I'm I'm the world worst with it, man. I mean, I struggle with that. I struggle with just saying I need some help.
Yeah.
you
Yeah.
know,
Yeah.
I mean,
Hey, Derek, I think we all there, bro. Mike, would you agree with that? Is that something that we all deal with?
Yeah, I absolutely think so. It's something that toxic masculinity. For those of you that don't know, that's something that with men, men struggling with that. And it's not talking about my man needs to be soft or feminine or nothing like that,
Right.
but
Yeah. No.
we know that we're supposed to be alpha males. We're supposed to be the protectors, the breadwinner. And so sometimes when that doesn't align and when it doesn't happen, then the man is feeling so much pressure, and then he ends up sometimes lashing out, and you're getting this displaced aggression against the wife, against the mom,
Mm,
girlfriend, or whatever your situation. It can
mm,
yeah,
really
mm-hmm,
ruin
mm-hmm.
relationships and things. And I know, I've seen it firsthand. So.
yeah, against the kids, against whoever, man. I mean,
Right. Right.
um, just just from simply not recognizing, man, we need a support system. We need somebody we can talk to. We need somebody that we can be open with, you know,
Mm,
um,
mm,
without without judgment. You know what I mean?
mm-hmm,
You
mm-hmm,
know,
mm-hmm.
and so I think for me is uh, I know I can go to the Lord and be transparent, right?
Mm-hmm. Okay.
But
Okay.
not everybody can handle your transparency.
That's right.
Um, you know,
Mm.
they say
Oh,
they can,
oh
but not
man,
everybody can handle it.
that's hard, dude. That's hard. That is
Yeah,
hard.
man.
Let me tell you. Let me tell you why that's hard. Because a lot of people expect me to be invincible because I'm like Superman. Like I'm not supposed to get hurt. I'm not supposed to ever be sick. But when I get sick, they ignore the fact that I'm sick. Like, oh, I'm
Mm,
dying right now, right?
Yeah,
But
mm,
but they don't believe it. They like, nah, you will always snap back.
Mm.
Yeah.
You'll always be okay. And so in my mind, I'm thinking, well, damn, okay, I gotta heal. No matter what's going on, I have to heal.
Mm-hmm.
Like
Yeah.
I gotta do it. That's toxic masculinity. It's embedded in our DNA for those of us who are true, men. Like
That's right.
you know what I'm saying? We are men. Like we do what men do, and we don't know any other way. So it's like, when I get sick, even my mom is like, "No, ain't nothing wrong with you.
Yeah. That's
Right.
right. That's
Yeah.
right.
Y'all just
Did
okay."
we
There we
lose?
go.
Did we
There we
lose
go.
There,
Remy?
there we go.
Oh,
There
I'm
we go.
back.
there.
I'm back.
Hey, we just talked about that earlier before you got on, Remy.
Right.
We were just talking
Yeah.
about that earlier.
Yeah.
All right. Fill
Absolutely.
me in. Fill me in. Well, fill me in about that. Tell me what y'all talked about.
Well, yeah, we talked
Well,
about the importance of mental health, and we talked about, like I said, with prostate health, we were talking about how we had this really organic conversation because it was several guys and just hanging around, and guys just kind of sitting back after work and having a couple of beverages, and they were just saying that man, this has just been such a hard time for me. And said, well, what do you mean? And one guy said, well, hey, what you think? Doc, man, I'm on this medication. I'm on metoprolol, or I'm on Eliquis, which is a blood thinner.
Right.
I've been
right.
having my heart rate going up to 130 or 140 beats a minute. And he said, and one gentleman said, I could be laying there in bed, uh, laying next to my wife, and I just, scared a mess out of her because I jump up and I'm like, oh my God. And so he says he went to the cardiologist, which is his heart specialist, and
Yeah.
one gentleman, they give him, a special monitor to monitor your heart rate. And another gentleman who was saying, man, I have something very similar. And what really jumped out at me was like, man, these two guys randomly in this place, how is it that both of them have a similar heart condition? And then we've got another gentleman who said, well, I think his father died of prostate cancer. His mom had breast cancer. So, that person has a high likelihood of cancer in the family. So all the more reason why they need to be screened by their primary doctor. But the problem is, ding, 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 that so many people don't have a primary doctor and they get all their health care in the ER. And that's why the health care is so bad amongst African American men, and especially in Mississippi.
Yeah.
Remy, you disappeared again, man. I just see nothing but trees, man.
I think he froze.
Oh, is it frozen? Okay, it could be
Yeah, I
frozen.
think he froze.
Okay, yeah, it could be. I'm telling me.
Hey, and I apologize, man. I'm in my truck and it's getting dark, so I'm trying to use all kind of lights
Oh yeah.
to make it work.
Okay. So I guess I think he's still having some issues there. I told him to come on back in. I messaged him, come on out, and
All right. There
okay.
we go. Am I
Yeah,
back?
there
I'm
he
back.
is.
There we
There he
go.
is.
There we
There
go.
he
I'm
is.
back, baby. Yeah, man.
So yeah, I was saying, Remy, we were just talking about, I had said my little blurb on that. The fact that did you hear about that? We were there and all these gentlemen had the same issues. There's Frank White. Frank White, he wasn't there, but he should have been there. But Frank, you can go ahead and weigh in, Frank, if you have any questions. We want everybody to know that if you can simply type your questions right here, we'll read it out. We will address any question right here. This is for you. I'm here to talk about the healthcare part. You've got Derek Rainey, Remy's here. So we want to talk about anything that maybe you're not comfortable with, your family, or even if it is your doctor, maybe you don't have that type of relationship, but we are here. This is a brotherhood, as we say. This is the place for you to come and talk about whatever it is that's bothering you, what you're curious about. So ask your questions. Come on. Let's
Okay, hey, yo, my phone is about to die, so I'm about to go.
see.
Oh
All
man.
right.
Okay.
Yeah, it's about to die. I'm on like
Typical
1%.
Android.
It's
Typical
dying.
Android.
Hey, I'll tell you, and while people are chiming in, getting ready to ask their questions, I'll share my story with you, and this may help this may help your listeners and your audience. Um, when we talk about cancer, Mike, that's one, man, that whether it's prostate, whether it's breast cancer, whether it's colon cancer, and I don't know the other cancers, but those seem to be the main ones. But man, my mother, when we were living in, me and my wife, we were living in Texas at the time. We were in Arlington, and my mother, man, got sick with breast cancer.
Yeah, sorry.
That was, yeah, that was back in matter of fact, December '97. She came out to Dallas. Good, came out to Arlington to stay with us like 2 weeks. So we was getting ready to move her and my brother out to Texas. She told me, she explained to me she had a knot on her breast, and this is back in '97, brother. So the last thing that I was thinking, or anybody was thinking, was cancer.
Mm-hmm.
And so she ended up, she told me she had this knot on her breast. She wanted to get it checked out. I was like, okay, cool. Well, you go ahead and do what you got to do, and we'll support you. And she came back home, brother, by mid-January '98. Now, she was just in Texas, December '97 for Christmas.
Okay.
By mid-January, they did a biopsy to see if it was cancer.
Mm.
By February of '98, my mother was diagnosed with cancer.
Wow.
By March of '98, she had a mastectomy. Had her left. Did I say that right? Did I say that right?
Yeah. You got it.
They removed her left breast, right? And from there, it was just a downhill battle. It was a struggle. Man, we was coming back and forth from Texas every other week, trying to take care of my mother. By October, I had made the decision to just move back home. Got to go home and take care of my mother. And bro, by February of '99, February 28, '99, at 6:08 p.m., my mother passed of cancer. That was a journey, and it did something to me, because it really, when I talked about trust, I was talking about personal experience, because when I went through that, man, I didn't know the questions to ask. I pretty much was like, whatever the hospital was administering, I pretty much just had to roll with it, because this was something that I'd never been through. You know what I mean? And I remember kept asking to see her doctor, and I never could see her doctor. On the evening she would pass, that Sunday morning, it was a Sunday, and I went up to the hospital, and I saw her oncologist. Didn't even know who he was, what it was. And he was standing at the foot of the bed, man. He was documenting, writing notes, or whatever he was doing. And I asked him, I said, "Who are you?" And I'm gonna refrain from names and all that, but I was like, well, when he told me who he was, I was like, man, I've been trying to see you for a minute, but didn't know that evening my mother would pass away. You know what I mean? So, needless to say, I was so angry. I carried that for a long time. I was very angry. You can imagine what it did for my trust, to my trust for the medical field, and there's some great doctors, great nurses, great nurse pracs, great people out there. But man, you got some out there that's just, it is what it is. I'll just be honest.
This was in now when you talk about the distrust in the medical community. This was your feeling when in Texas, or was it once you brought her here, or that was your experience?
This was here. This was here.
Here.
Yeah.
Gotcha. Man, that's such a, and again, man, and I know that was over 25 years ago, but it's never a time when I'm sure a person doesn't miss their parent. I lost my father 10, 11 years ago, and so and I hate to hear that, man. That's a very tragic story, and what makes it even worse, which is what I was saying yesterday, is that something like breast cancer, and even though, like I said, that was even over 25 years ago, now mammograms have gotten so much more accurate, so much more sensitive and specific, and all those different, medical terms. But
Right.
basically, in a nutshell, they've gotten so much better at detecting stuff like this. And then, if a person has a spot or a nodule, then you can go for what they call a diagnostic mammogram, which is a different type of mammogram that centers and focuses only on that area, and you get a diagnostic ultrasound. And
Hmm.
then after that, usually like a fine needle aspiration or biopsy. Then after that, like just like you said, if there need be, if you're required to see a surgeon, all of that kind of thing. But bottom line, by doing something simple and painless, to be able to see, whether somebody, I know some women have said, well, depending on your stature, it could be somewhat uncomfortable to have a mammogram. But at the end of the day, it would be I'm sure a person would prefer to be somewhat uncomfortable in a mammogram than
Yeah.
to have the other alternative. So, again, my heart goes out because I hate to hear that. And there are still, unfortunately, people that are suffering from, this same thing today with all the medical breakthroughs and the information that we have.
Right. Right. And so back then, like you just said, back then, man, we were not thinking that. We didn't have that
Yeah.
kind of technology, and it just seemed like everything was just so streamlined.
Mhm.
Everything was like, it was like, okay, here's the biopsy, here's the diagnosis, here's what we're gonna do, and everything was just fast. But now, man, like you said, and that's your arena. I think we've come so much farther in terms of technology, information, wisdom we've gained throughout the years of how to help, how to deal with patients with persons with cancer, and
Mhm.
so that's huge, man.
Yeah, absolutely, man. I wanted to send a special shout out to my childhood friend there, man, Calvin McCoy. If you're still listening, man, it's good to see you, brother. Back home in Orlando, Florida, man. We go way back to Mount Sinai SDA Church in Orlando, Florida, man. When we were in Orlando, they called it jits. That's like little kids, like when you were. Yeah, man. And he's had a birthday. His birthday's in March, like mine. Happy belated birthday, man. Good to see you on here. Um, let's see, 7:50. I think we got about 10 more minutes.
Yeah,
So I appreciate you, man, sharing that story. And it's the same thing. Like when I first came to Mississippi, when I was hearing about people dying from asthma, and even recently, I heard, a couple of months ago, there was somebody in a kind of an extended, um, in an extended wave from one of the groups that I'm in, or a distant relative, who passed away from asthma. And again, that is just something that, from my standpoint, I just find ridiculous because, man, we've got pulmonologists, which are lung doctors. We've got um, all these great drugs, Advair and Symbicort and Breztri and Brio and all this stuff. We've got inhalers that are cheap, that are now like albuterol inhalers that are cheap, which people
yeah.
call a rescue inhaler or a rescue puffer. You've got nebulizer machines, and so there are just so many things that if people would just simply, you know, do what they need to do and do the responsible thing, which is come on to the doctor, do what you need
I
to
got
do.
all of those. I got all of those, Mike.
You got
everything you just everything you just called.
all of them. Oh Lord.
Hey, look, I got the Symbicort, I got the emergency inhaler, I got the nebulizer.
Mm,
But man, I have a great pulmonologist though. I have a great pulmonologist, and the funny part, like again, when we talking about men, and that's what we led with.
that's right.
When I got to my man, I would say, I'm 50. It
Hmm.
wasn't until I got around about 42 that I really started taking my health serious.
Mm,
And I kept going to trust care, man. I kept having these bronchial episodes every year in the spring, in the fall, and So I'm thinking, I go in there, and it was a brother in there. He was a nurse prac, and this goes back to showing what you just talked about. He was a brother. I don't have anything against in Asian, black, whatever, but this was a black guy.
Yeah, absolutely.
And I said to him, I said, man, I need to I need to go to an ear, nose, and throat doctor. Like I'm trying to diagnose myself, right? And he said, brother, why you want to go to an ear, nose, and throat doctor? I said, man, I keep having this stuff going on, and I said, man, I'm really tired of it. I get sick
Yeah.
every change of the season in the spring, with pollen, ragweed in the fall, right?
Mm.
So he goes out, he leaves the room, the exam room. He reviews my charts, and he come back and he said, brother, he said, man, I'm gonna refer you to a pulmonologist.
Mm.
And I was like, man, what is that? He said a pulmonologist is a respiratory doctor. They deal with the lungs and all that. And I was like, okay. I said, why do you want to refer me? He said, man, I believe you got asthma. This
Mm.
this is it. So I just recently was diagnosed with asthma about 5, 6 years ago. You
Wow.
see what
So
I'm
you're
saying?
45 years old.
And grew into it.
Wow.
My brother grew out of it. I
Right.
grew into it. And what my pulmonologist told me, can I call his name? I don't know.
Oh yeah. No, I had him on the show. I had him on the show. Yeah.
Oh, okay. Raymond Porter's. That's my guy.
Oh yeah.
And
I got.
when Raymond checked me out, he's like, man, yeah, you got allergy induced asthma,
Mm-hmm.
and I am allergic. So Raymond did such a thorough job, man. That. So he's my pulmonologist. He then referred me to a heart doctor. They follow me, Dr. Sanders, them. They followed me, man, for 2, 3 years to make sure that everything was good. Um, and then I have an allergy. I have an allergist too. So,
Mm-hmm.
man, but that's something that came about. It was induced by by allergies, and
Mm-hmm.
so I'm allergic. I learned that, man, I'm allergic to everything outside. So I can't cut grass. I can't do any of that, man. So,
Man.
um, that's so again, that's something that I grew into, and then from there, man, I just started like, okay, I became a member at Ovation's Men Wellness Clinic.
Mm-hmm.
My good my good friend Jesse Mitchell, he told me about them, and I was like, man, I got to check them out, and so started going became a member there, and they do the complete lab panels on you, man, to make sure that everything is okay, and so
Yeah.
I feel really good right now about my health, and but it's something I had to take serious. It was a fear that I had to overcome because I didn't want to go. I didn't want to go to a doctor. And even if I felt some kind of way, bad headache, whatever, excruciating pain, as a man, it was just something I didn't want to do, and so that's something that as men, as brothers, we gotta do a better job of that. We gotta take our health serious.
Yeah, absolutely, absolutely. And like I said, man, I really appreciate the personal because that really brings it home for a lot of people because it's like, we're not just like on, say, CNN, some talking heads and political pundits just saying a bunch of crap. This is real life. Like you told the story about your mom, unfortunately, who had, breast cancer and passed from
Yeah,
that. You talked
yeah,
about yourself being 45 years old and finding out you have allergy induced asthma. Um,
yeah,
and like I said, those are certain things, especially in this day and time where we have so much information, so much data, such great medication, drugs that can fight these things. And it would be a shame for somebody to, pass away because of it. That's why I have a talk on that where every now and then when I go and do speeches to talk somewhere, we talk about it. And I said, the topic of my talk is an annual exam or a trip to the grave. The choice is yours. So,
yeah. So and it's funny you should mention that because I saw Todd earlier today.
right.
I was in Meridian on Friday. Went over to see a good friend of mine who teaches the automotive program over there in Meridian, and I went by Spring Street over there, right?
Mm-hmm.
And Todd was telling me when I went in, they had this picture of this guy that they were remembering, right? And sadly, this goes back to the mental health thing that you talked
Yeah.
about. Todd was telling me, and of course the young lady who worked there, she told me that the manager who managed that store had
Mm-hmm.
passed away. And so Todd talked about it today, and come to find out, they believe the guy just laid down. He wasn't very old, but they feel like he laid down and perhaps forgot to put his CPAP machine on,
Mm-hmm.
and what is it? Fixated? What you call it, Mike? You
Like
know, when you choke to death.
asphyxiation.
That's what they believe happened to him. And the other gentleman, the guy that I saw on the picture, he was so close to this guy that he couldn't deal with his death. He couldn't cope with his departure, and
Mm-hmm.
he took his own life. See, so that's that mental health piece that you was talking about earlier.
Right.
You know,
Exactly.
having somebody to be able to talk to.
Yeah. That's it's it's so sad, man. When you hear stuff like that, it's so sad, man. We've got, let's see, a question here from my lovely mother, Dr.
Okay.
Lily James. We appreciate you. Thank you so much for tuning in, Mom. So she's asking, when should men start having prostate exams so that problems can be caught early? And that's an excellent question, and the answer is it's the same as colonoscopy, which typically with most people is 50 years old. But if you have risk factors such as a first degree relative or two extended relatives, so like first degree is your father, something like that, and extended relatives, older cousin or something like that. So if you have one first degree relative or two or more extended relatives, then they recommend doing it at 45. But now, if either one of those people in those categories might have had their disease process or cancer or in large part, where if they had it at say 43, then you would go a couple years before them at maybe 40, 41. But typically it's 50 years old for all men, 45 for some African American, or if you had first degree relative that had prostate cancer or a really large prostate that caused significant symptoms. So,
Yeah. What's
yeah,
her name? Lily?
yeah,
Was it Lily?
yep.
Well, Lily. I'm gonna tell you. Look, I got my first one at 42.
Wow.
I was 42, and let me tell you, I wasn't happy with the procedure.
I'm sure, I'm sure you.
ain't no ain't no man gonna be comfortable with the procedure.
No,
But
that large
but
hand.
yeah, man, I'm like, no, this. Hey, let me tell you, I was so uncomfortable. I said, man, we got sonograms. You can't do a sonogram down there or something. Hey, Mike, I wanted a sonogram, but I got it done at 42, and but now with the with the PSA levels,
That's right.
it's not as uncomfortable. So I would encourage a brother to start. When you break them 40s, it's something to start thinking about because every man is different. Um, but Mike is the medical expert on that. I'm not gonna try to overstep that boundary, but I did mine at 42, and there was no history of it in my family, but I just did it at
Oh,
42.
well, now we do have some people who, let's say if they just want to have it done, and even if, we've had people to say, hey, I just want to have it done. And even if I have to pay for it out of pocket or whatever. And that's reasonable, or if you really worried about it. But, and then the interesting thing is, let's say if you have no risk factors, nobody in your family with prostate issues or cancer, and let's say you have it at 50, you can stop being screened for it at 70. So that's usually the case for most things, 65, 70. So with breast cancer, with mammograms and all that kind of stuff, 65, colonoscopy 70, pap smears, that's a little bit more complicated because based on, if you've had, based on your age, or if you've had two abnormal pap smears, but you're a certain age. And so pap smear is a little more complicated, and the mammogram is as well. But colonoscopy every 10 years, now 45 for African American males, every 10 years if it's normal, every 5 years if you have polyps, and then normally again stopping at 70 unless you have something going on where you have a significant amount of polyps or large hemorrhoids that could be causing like a lot of bleeding or but significant diverticulosis, which causes a lot of intermittent like bleeding and stuff. So that's why medicine is truly an art. It's a practice, but we do have those guidelines set up. And again, that's why you would get all this knowledge and all these things if you simply go to the family medicine or your primary care physician. So, that's, we want to really highlight that. I think it's a tough subject, man, because like I said, you were sharing personal things about yourself, your family, your history, which we definitely applaud that. We need to do more because people shouldn't feel shamed like, oh, I'm embarrassed to do this. I don't want to talk. It's just like we have, people in the family who say, well, somebody gets divorced, they don't want to talk about it. Somebody's having a problem. That's where we go wrong. It's like, when people say come to church and they would, sometimes they would look at somebody going to church with tattered clothes or maybe somebody you think the woman's skirt is too short. They say, well, this is like a hospital. You don't see well people walking in the hospital. You see sick folks. So that's the
Yeah.
same thing.
Right. Exactly. Well, I appreciate you having me on, man, and of course, like I said before, I'm not ashamed to share, man. It's a part of my story, but it's also responsible for shaping the kind of person that I am today too. So, and I still want to, I still want to grow and develop and get better in that, man. But I think about what happened with a friend just a few weeks ago. One of our good friends that was sitting right among us, man, and just and passed out, And then when we got to the hospital, I said, man, how I asked, I said, man, how long you been feeling like this, bro? And it was just something he didn't, he was grappling with it himself. It was something that he manned up and thought he was strong enough to overcome it until it was good that some brothers was there. You see what I'm saying?
Absolutely.
And so now after that episode, man, I think you're starting to see a lot more guys come out and they're being more open about what's going on with them medically or what's going on with them physically.
Mm-hmm.
And I think that's what we were part of last night.
Yeah, absolutely. Because the ladies are definitely going to be transparent with each other. They're going to talk about this and that. Even when some of them do self breast exams, and everybody knows the women will go show each other this and that. Girl, look at this, and look at it. What you think this is? Go ahead and touch it right there. Touch it.
Nah, we ain't finna do that.
Yeah, look at this jock strap, man. Look at this. What you think? but yeah, we've definitely got to do better. I think that. So hopefully we keep, and hopefully we'll be able to talk about your podcast and what you're doing. Matter of fact, you can tell us as we close because we need to be more on that. By the way, I want to close with this. I want to make mention of something. We had a couple of folks over and very close people that have become family to us. Miss Betty and Miss Diane. If ever, people that know me, they've probably heard those names or maybe even gotten to meet them. Just wonderful, wonderful ladies, and they're like two aunties, and they're gonna give it to me straight. And we were just, but yeah, we were just talking about those kind of things. Holding each other accountable. Just doing better. They're both retired nurses, so just doing better, holding each other accountable because we've got everything we need. We've got the tools. God is working through us. You know, and if you believe in God, you know, and hey, if you don't, even if you focus just on the science, we've got the technology, we've got the science, but of course that we, you know, you and I believe in the great physician. Um,
Oh, absolutely.
yeah, man. So we're here. Look, nobody has an excuse. I'm here to say that as the good Lord gives us strength and gives me the ability, we'll be here each and every Tuesday, 7 p.m. We got all kind of different topics and speakers, but no question is off limits. So, hey, if you don't have a doctor, we'll find you one. You know, if you have Medicare or you know Medicare Advantage, you know, you can come on and see me personally at Centerwell. Um, but also if you don't have it, then I know plenty of doctors who will take good care of you. And so we'll get you where you need to be. So nobody should have an excuse, whether you have insurance or not. You can be cared for, and you should not die from certain things like preventable disease, preventable or at least early detectable things like breast cancer, colon cancer, prostate cancer, asthma. You should not die from that. So I'm gonna turn it over to you, Derek Rainey. Tell us, man. Let everybody know what you're doing, if you're doing podcasts, and where they can find you.
Well, I don't have a podcast just yet, but man, you can find me on Facebook. Just type in Derek Rainey. But my YouTube channel, I just launched this, like literally, just launched the Speak Fluence YouTube channel, which is on YouTube. You can just type in Speak Fluence, go
Awesome.
there and subscribe. And really, man, when you look at when you just look at how people are talking today, and you look at how just the way we've just broken down I guess we call it ebonics, we call it whatever, but man, just good authentic speaking, communicating, public
Absolutely.
speaking. That art, man, has gotten away from us.
Man,
Because
far
it,
away.
it's horrible, man. I mean, even the way, I have students that literally text me the way they be talking, and I be trying to read it, and I'm like, man, what is this? And so,
What is
and
this?
so I want to try to save it, man. I want to try to help people, man, to speak, to be a good presenter when they get up on stage, whatever it is they do, whether you're an educator, whether you are a realtor, a lawyer, whatever it is. I want to help them to be able to bring themselves out and be able to present in a way that's memorable for whatever audience they get up in front of.
Yeah, absolutely.
Yeah. So I appreciate you again, Mike, for having me on here, brother. This has been good, man.
Yeah, this is great. I'm glad you could join us, man. We need to, I'm sure we'll do it again, even personally and everything. But
Yeah.
let's do this again. Maybe we can get those guys to do right, man, and get on this camera with us. We'll do like a round table discussion again, something like that.
Absolutely. And I won't be in my truck the next time, man. So
Oh
I
yeah,
apologize for that.
hey, no problem at all, man. That makes it even all the more authentic. Well, awesome. Well, look, ladies and gentlemen, I know it's 8:11, so we're going to let you go. And again, we want to thank Mr. Derek Rainey and Speak Fluence. And so he told you where you can find him. So reach out to him. Thank you for all the hometown heroes that have joined us. I saw Calvin was there. Remy joined us on. My mother came on. My cousin Shirley Campbell. We had Frank White, Kanoy, all kind of people that have joined us. And we want to give you a shout out. So, ladies and gentlemen, this is the place where you can find us each and every Tuesday, 7 p.m., 7 to 8 p.m. Central. Lord willing, this is the place where we discuss and treat and take questions about anything. There's no question or comment that's off limits. This is truly a place of non-judgment. So next week, we will plan to see you. Please bring a friend. Don't forget to share, tag, like, Dr. B TV, DOCTOR, the letter B is in boy TV, which is our YouTube channel, and the all new Michael Bookhardt, MD, MBA Facebook page. So we would love for you all to come there. Please share that. Please subscribe. Please support us. Support my brother Derek's with his work and his business. And we'll be there for you. So next week, 7 p.m., we'll have a very special guest. You'll hear about that. So just make sure to stay tuned, and we'll see you. And remember, true wealth begins with good health. See you next Tuesday. Hello, I'm Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health.